This is part one of Medopia's podcast. Today we have Dr. Hannah Kopelman as our first guest, and I'm honestly thrilled to have you with us. Thank you so much for having the time to do this podcast.
Thank you for having me.
Okay, so to give
I'm thrilled to be here.
thank you so much. So to give a bit of information of who Dr. Kopelman is, she got her bachelor degree from Emory University. She majored in biology. She got her medical degree from Touro College, completed her internship at St. John's Hospital. She's dual fellowship trained in cutaneous oncology from Boston University and in hair loss from Columbia University. And not only is she a professional in the medical field, but she's also completing her MBA at Boston University, Custom School of Business. Um, she has a YouTube channel, has a podcast called Derm Club, which focuses on treating dermatologic skin conditions. She's also the co-founder of the company called DermOnDemand, which we'll talk about later on. Now, I've already described about your profession and where you went to college, but I would also like to hear from you about your childhood, the high school you went to, where you did your residency, and also like the hospitals you worked in the past.
Sure. So, growing up, I grew up in a family of doctors. My father is a physician. So, oftentimes he would come home and when I was a young girl, and he would talk about the interesting medical cases that he saw that day or during the week. And, I grew up always having family dinners, even at an age of 5 or 6. So, these stories went way back. Um, and through hearing his stories of how he was impacting other people's lives, it obviously inspired me to pursue medicine and to pursue a life where I, in my career, take care of patients and, make them feel better and help them. So here I am today as a doctor. Um, but I started off, I would say, I feel like I've been pursuing medicine for the entirety of my life because it doesn't just start when you're in medical school. It really starts way before that. Obviously, it starts with your interests, but I would say my passion started in, middle school to high school when you're taking just general science classes. And I always really enjoyed those science classes more than say my English class. Um, and I felt like it was my strong suit. And of course, at times the science classes could get hard, but I once heard someone say, just because it's hard doesn't mean it's not for you or that you shouldn't pursue it or that you shouldn't like it. So, um, I always focus my attention and my studies throughout my life in high school, in college, mostly on the sciences. And um, and it really pursued me to want to go into a career that is very gratifying and satisfying and where I learn something new every day. I went to a private school, very local private school near my house. It was called Dwight Englewood. And it's a wide range of classes. You don't only learn sciences, but you're taught a little of everything. I learned to speak Spanish there, and I still speak Spanish until this day. And I speak Spanish to my patients, so I have them to thank for that. And after high school, I went to college at Emory University, where I was a pre-med. And so that means you prepare, like you basically tailor your studies as if you're going to be applying to medical school, because every medical school has requirements of which classes you need to take in order to basically check off the boxes and be an accepted applicant. So I was on the pre-med track and I was a biology major. So most of my classes were in the sciences, but of course I took other courses as well. But I enjoyed, I took some courses that I actually could still think about today. One being, took a course, it was an elective in college, where I went, which was Emory University in Atlanta, Georgia. And I took a class on epigenetics. And epigenetics, till this day, is very relevant, even in what I do currently. And it can, have an impact on different skin conditions, or other diseases. So it's amazing that you go to college and you think, oh, am I ever going to use this information? And yes, you're not going to use every bit of it, but you'll see later in life that different threads of it will come through.
Okay, so like what were the hospitals that you worked in the past?
So I worked at, so when I was a medical student, I did medical school in New York. And so the first 2 years of medical school, you take the medical school classes. And then as you enter your third year, you go into a period of time called rotations. And you basically do your third and fourth year of medical. So medical school is 4 years in the United States. And the first 2 years are classes, and the last 2 years are typically rotations. So I did my rotations in a local hospital in my area. Um, and I did them in all different areas. So I did internal medicine, um, I did surgery, we did an OBGYN rotation, I did dermatology rotation, family medicine, pediatrics. So the idea is to get a taste of every specialty. So it can give you an option of what resonates with you and what area that you want to practice. So that was during medical school.
That's nice. So you mentioned that your father is also a doctor, and I think that like you had a role model growing up, but were there like any other encouraging factor that made you say, I will become a doctor, like I have to become a doctor?
I think it's well, so my father's a doctor, but so is my brother. And I actually went to medical school with my brother. So I think that it's part of my DNA. And it's really like ingrained in me that in my nature and my personality that I was going to become a doctor. Nobody told me you have to be a doctor, or this is like there's no other choice for you, but this is what you have to do. I just always had the inclination that I wanted to help people. And I would say the people that inspired me the most to pursue medicine are my grandparents. Um, One of my grandmothers is 96 and a half, close to 97 in 6 months. And she lives with us. And being able to take care of her every day, having my background of medical knowledge, makes me feel confident that I made the right decision, because I feel like I can give her a longer and better quality of life.
Like what made you choose dermatology as your specialty? Are there like any specific reason?
So I chose dermatology because, well, actually, my great grandfather, um, who I'm named after, his name is Harry. His name was Harry, and my name is Hannah. So my great grandfather had something called a T cell lymphoma, which was a type of cancer, skin cancer. It also can go into your blood, but he had this type of cancer. And at the time, it was many years ago, there was really not a lot of information about how to treat it, what it was. And obviously, there's been a lot of medical advancements since that time. So we know a lot more than we did then. But no, I know that I had heard stories. I never unfortunately got to meet him, but I had heard stories when I was younger that he had this rare cancer that unfortunately he succumbed to the disease. And he was presented at what you call grand rounds. When you're a resident, they host grand rounds in the hospital like once a month to present different cases and get an opinion on them, multidisciplinary opinions on them from different specialists. And my great grandfather was one of those people who was presented. And knowing that I can continue to live out this legacy of being a doctor and being able to help patients live a much longer life than he was able to live is is like reassuring and comforting.
That's really nice. So you finished medical school with your brother, which I believe was like a major support throughout like the whole entire like 4 years. But like overall, how was med school for you? Like because like I hear almost everyone say that med school is hard, and it is hard, but how was it like for you?
So I definitely wouldn't do it again. I wouldn't go back and repeat it. But with that said, I definitely inspire and encourage people to, um, if medicine is your passion and if you want to help people, then there's no better field than being a doctor. It's definitely not easy. Um, I would say the first 2 years are, very trying and challenging. There's a lot of studying, and you have to be completely dedicated and devoted to why you're there and what you're doing, and not lose sight over it. There's many times in the beginning, like in the first year of medical school, you take anatomy, and it's very challenging when you're never like learned anatomy before. I had no reference, no background. Um, and or you learn physiology, and there's many challenging courses. And at many times I said, "Oh, I don't know if I could do this. I don't know if I could do this." And I know a lot of my friends felt the same way. They just wanted to give up. But I encourage you that if you feel that taking care of people, which I believe there's no field that's more gratifying than that, then you should pursue it and don't give up, because the first 2 years are temporary and it does get better.
Did you do any internship programs during high school that like made you know what medicine was like prior entering med school itself?
I did I did some volunteer work. I worked with an ambulance um, for a little bit. I spent time working in different doctors' offices. Um, but I would say like that was the majority of my work. I do have friends that also went on like mission trips to different countries. Actually, my brother and my father did a mission trip to Haiti after a earthquake, and they went to help patients who were injured from the earthquake. So all of these experiences, have led me to where I am today.
So one of the weirdest questions like that I get from my peers that want to pursue medicine is that like how will I be able like to memorize all those things that I learned?
So there's definitely a lot to know. And in medical school, you're learning at an extremely fast pace. Like in my medical school, we had two exams every single Monday for 2 years straight. So it's hard. You kind of don't have a balanced life for 2 years, socially, personally, because you're just really in the trenches of studying. Um, but it becomes so routine, and you see it over and over again throughout the years. And when I would say you really, they do expect you almost to be encyclopedic with your knowledge. But I would say that as you go into your rotations and you see things in real life, um, and you're able to apply whatever you learned in the textbook to a patient or a situation, you're just going to remember it, and it's going to be second nature at that point. And then you start to, once you pick a field that you really want to focus on, then you're going to be that expert in that field. And you may not remember everything, every little nuance or every detail about something else, but whatever you're focused on, it's going to be second nature because you're going to be tested on it, you're going to be asked it, and you're going to see it so many times.
How was your social life?
So like I said, the first 2 years of medical school are tough. And even going back to high school and college, I personally am someone that enjoys studying um, and learning, but it's not for everyone. In high school, I was that person that if I had a biology test on Monday or Tuesday, I was studying all weekend. I wasn't going out to the party on Saturday night. And in college, it was the same way. Like if I had a big exam, that was my focus. So, and I wouldn't go out and party, or it just takes that. You have to know what's important to you. And yes, you do make sacrifices, but I believe like it's worth it. And it's very important to have a strong support system, so you can get through the times that are challenging. And it's hard because you can compare yourself to your friends who may not be pursuing medicine and are out and doing something fun, and you're not. But it's in the end, it pays off. And so, do I remember all the times that I didn't go out and my other friends did? No, because I'm happy with where I am now. So, and I think it really depends on your personality. If you're someone that loves to go out and loves to socialize and doesn't want anything to interfere with that, then maybe medicine is not right for you. But you always, I think, even amongst the most stressful times in your studying career to prepare for medical school or to prepare for residency, you always try to make some time for family and friends. It's important to have some sort of balance, um, and maintain your friendships because you don't want to be completely isolated.
Definitely. So let's now move on to the questions related to dermatology. The first point that I wanted to raise was about skin cancer. And let's talk about the most common types: basal cell carcinoma, squamous cell carcinoma, and melanoma. What are they? How can they be prevented? And what are the treatment options?
So, okay, so you mentioned the three most common skin cancer types. And I would say, actually, out of all of these, basal cells and squamous cells are the most common. Um, and so, basal cells are typically found on, you can find them anywhere. They are the best type of skin. If you can have a skin cancer, it's usually they say it's the best skin cancer you can have because they grow very slowly. Many people, if most of them are due to time spent in the sun. Um, and you can often find them on people's faces, but also on their backs and their chest and their arms and their legs. Um, Squamous cell carcinomas, also similar to, and by the way, for basal cells, if you want like an identifying factor, they usually have a rolled border, and you could see like little, if you look very closely, sometimes you could see little blood vessels in the cancer. So if you notice one, they're pretty easy to treat if you find it early on. Usually it would require you going to a dermatologist. They would take a look at it. If it said like this looks like a skin cancer, they'll take a little sample with a biopsy, and they'll send the biopsy to a lab, and then the lab will a pathologist will identify it and say, yes, this is cancer, or no, it's not, it's benign, or it's something else. And if it's cancer, then you could have it surgically removed. And most people do very well and heal, and they do just fine. But if you have one basal cell, it definitely increases your risk of having others in the future. Squamous cell carcinomas are like the second best skin cancer to have. They kind of have more of a like warty appearance to them, or a pearly appearance to them. Um, and you can find them sometimes on people's lips or their ears, also due to the sun. They grow a little more aggressively than basal cell carcinomas, but also if they're identified, you can have them biopsied the same way and removed, and usually they're fine and they don't spread. However, some patients come to see a doctor or a dermatologist a little bit too late. So at that point, they're become harder to treat, and you might need some further workup and treatments. For melanomas, they are rare, but they're the most dangerous type of skin cancer. And becoming more increasingly, their incidence is increasing. I'm not sure. We think part of it is that we are getting better at identifying them and we're seeing them earlier on. So the incidence, that might be one of the reasons the incidence is increasing for melanoma. Um, but for melanoma, it is a dangerous and deathly cancer. So, in terms of melanoma, I always tell people that you should, no one knows their skin better than you know yourself. So, always do regular skin checks on yourself. If you see something abnormal, then definitely go see a doctor. And in terms of melanoma, as I said, you can use the ABCD method, which would be A would stand for asymmetry, B is so basically I always think of a black and white cookie if they're asymmetric. So like they basically, if they're not a mirror image of each of itself, on if your melanoma does not look like, if I cut my hand in half and it doesn't look like the other side, in terms of a mole, then I would be it could be an area for concern. Look at the borders, so you want to make sure that the borders look regular and not out of line. So I always tell people it's like a coloring book. If you start to notice that people are, if the mole is starting to get out of line, like if someone were to color out of line, then that is also another area of concern. Look at the color. So if you start to notice that they're dark brown or black, um, definitely would see a doctor. And then if they're starting to grow rapidly, that's another reason to be concerned. And if you start to have symptoms like bleeding or pain, definitely go see your dermatologist. But in terms of protection against all three of these three skin cancers that were mentioned, the most important thing is sunscreen. And seeking shade and staying out of the sun when you can, definitely during the peak hours. And even in terms on top of sunscreen, you want to pick a broad spectrum sunscreen that can protect you against the UVA rays and UVB rays, the ones that cause aging and wrinkles, but also the ones that cause sunburns, because the ones that cause sunburns are the ones that can cause skin cancer. And you also want to use some protective clothing. So that is the best like they make now clothing with UPF in it. So hats, tops, shirts, bathing suits. And now a lot of these clothing items are becoming more fashionable and trendy. So they're becoming more acceptable amongst women and men. And that's the most important thing, is protecting yourself from the sun. And that goes, by the way, all skin cancers they don't discriminate. They can affect all genders, all skin types, all ethnicities and races. So um, people with skin of color are at a lower risk for developing skin cancer because their skin is darker, but they can still develop it. And one example is Bob Marley, actually, who is a famous singer. He actually died from a melanoma on his foot. So that's just an example of one person who was affected by skin cancer, and he has darker skin. So everyone of all skin types should be wearing sunscreen. And now they make sunscreen with tint in it. So it blends better and it's more cosmetically appealing. And if you want to know more, you could check out my YouTube video on melanoma on my YouTube channel.
All right. What is the best skincare routine you recommend to avoid skin disorders and have a natural skin?
My recommendation is simple is best. So try to not overload your skincare routine. And obviously it depends on what at first I always ask people, like, what's your goals and what are you looking to do? Some people, it depends on their age, want to focus on aging. Some people want to focus on their skin coloring. And some people just want to focus on not having acne. So first you have to ask yourself what your goal is for your skin. But either way, I always say try to be simple and keep a simple routine. For example, actually, my skincare routine for the morning is going live tomorrow on YouTube, so you could check it out. But my skincare routine is really simple. I just get up in the morning, rinse my face off, wash it off with some cleanser, very gentle cleanser that doesn't have fragrances or dyes in it. It's super clean. I always tell people try to stay away from fragrances because fragrances can cause rashes and also dry out your skin more. And then I basically follow it my cleanser with a gentle moisturizer that won't clog my pores and won't cause acne. But obviously, if you have acne, then you want to tailor it and use medication that will treat your acne. But bottom line is try to keep it simple and don't overdo it.
What about like herbs? Most people in our country, for example, they use various herbs, even like vegetables and fruits. They just put that like on their skin. Is it appropriate? Is it good for the skin? Does it have like a potential of causing a disease?
It's not going to cause disease, but it's can cause something called contact dermatitis. So some of the I personally would not. I know I see all the time people putting fruit mask and honey mask and egg yolk mask and I mean you name it. They're trying it and they're doing it. And yes, there's possibly some anti-inflammatory component to it, but overall I would say that I would be cautious, especially if you have sensitive skin, because anything that, even though they're natural fruits, they can cause um, chemical burns or allergic reactions and contact dermatitis, a rash. And so I would just proceed with caution. I don't personally think that makes your skin any smoother or more beautiful.
Mhm. You recently talked about this on your YouTube channel about dandruffs. What are they? How can it be treated and how can it be avoided as well?
So dandruff is one of the most common skin conditions I treat in patients. And it's also called seborrheic dermatitis. So it's like those white, if you're listening to this and you have white flakes on your scalp, um, or your scalp seems itchy and you notice kind of flakes that are even sitting, they could be sitting on your shoulders. Um, that it's very possible that you have dandruff, which is actually a yeast. So everyone naturally has yeast on their skin, flora, but some people get an overgrowth. And it does not mean something's wrong with you. It's very, very common. I see it all the time. Um, but it just, and there's no like real way to get rid of the yeast. I mean, there's ways to like treat the infection, but it's chronic. So you're going to always have it. And there could be times where it waxes and wanes, but for the most part, it's going to be there. And there are good treatment options out there, like antifungal shampoos, um, that either you can buy over the counter or with a prescription. Um, and I always recommend, I actually met someone last night. I was at a dinner party and she told me she has very bad dandruff and she's tried all the shampoos and nothing works. And the only thing that works, she said, was like coconut oil or something. And I said, no, you're not using it right. And most people who have dandruff, who have tried the anti dandruff shampoos and they say it doesn't work, it's because they're not using them the right way. And because they're not being educated on how to use it. And the right way to properly use it to get the most effect from it is by massaging the shampoos into your scalp for a little while and leave it there for about 10 to 20 minutes and then rinse your hair out. And if you repeat that a few times a week, I think that most people who suffer with dandruff will see an improvement in their skin condition. But I want everyone to know that this is chronic. So it's not like you wash your hair 3 times and it goes away and then your like condition is gone forever. It's going to come back. And I have people come in all the time and they say, it went away, but it's back again. And we're like, are you using the shampoo? No, I stopped. It went away. This is a chronic condition. It's going to live with you. So um, the best way to do it is just keep up maintenance with your anti-dandruff shampoos, and I think you'll be much better.
Let's now move on to the rare diseases. What are the diseases that aren't getting the attention that they should be given? Like kind of being ignorant.
So I would say there's some hair disorders that um, don't get a lot of attention, but they're starting to, um, particularly actually in people of skin of color. There's scarring and non-scarring alopecia. So, for example, one is called central alopecia (CCCA), um, and there wasn't a lot of research done on this topic for a while, but now there's starting to be, and a lot of women suffer with this, and also men. So I would say there are a lot of hair loss disorders that aren't getting enough attention, but it's starting to change the landscape. And also, another condition that's starting to get a lot more attention is hidradenitis suppurativa, which is kind of like these big ingrowns or cysts that can be under your armpits or in your groin area. Um, and part of the reason I think that they didn't get enough attention is no one really could understand the physiology of what caused it. But there's a lot more research being done and treatment options coming out. So, the two areas that in the past weren't getting a lot of attention, but things are starting to change.
We're almost out of time, but as our last topic, tell us a bit about your company, DermOnDemand. What's its purpose? What are you guys currently working on? And also about your podcast, Derm Club.
Sure. So, I started podcast called Derm Club. It's on YouTube, Spotify, and Apple. You can listen or watch the live podcast. And I've interviewed 60 and counting of dermatologists, and now I'm starting to expand into other areas of healthcare and skincare. And my mission really was that I wanted to both learn and share with the public about different skin conditions that affect people worldwide. I didn't feel like there were a great option for either patients who are suffering with that condition, or even for practitioners who maybe not practice dermatology but who practice family medicine. It's an avenue for them to learn about that condition, so that maybe in their practice they can start to diagnose it and manage it, and recognize it better. So that's called Derm Club. And then my company that I recently started is called DermOnDemand, where we diagnose and treat skin conditions, acute and chronic conditions. So ranging from acne to eczema to psoriasis to rashes, to melasma and rosacea, we basically all skin conditions. And the process is that it's patient will take a picture of their skin concern. They'll take 3 photos. They'll send their photos, and then they'll answer a survey about their condition, when it started, and some background, so we can get data on it, and then we will get it, and within 89 seconds they'll be diagnosed, and within 24 hours they'll get a diagnosis and treatment plan back from a dermatologist. And so I encourage people from all over to, if you are suffering with any skin conditions, and you don't know what it is or need help, and you don't have an outlet, you can reach out to us on DermOnDemand, and it's very convenient. There's no wait time to see a doctor. There's no commuting to a doctor's office. It's all from the convenience of your home or your cell phone or your computer. And we put you at ease very quickly. Within 24 hours, you'll know what you have and how to treat it.
That's really nice. I'm done with my questions, but if you have any last message that you want to say to students that want to pursue medicine or any kind of message, please do.
Yes, I just want to say that pursuing dermatology was always my dream, and I really set my eyes on it and my heart on it. And it wasn't easy to get to where I am today, but be persistent and persevere and don't give up. So if the first time doesn't work out, then just keep working at it and it's going to work out. And if it's meant to be that you're that specialist or that particular doctor, you can make it happen. Hard work pays off.
Again, thank you so much for having this.
Thank you for that.
Thank you very much. Make sure to check out her YouTube channel. It's called Dr. Hannah Kopelman. You can get so many informations on there. Again, thank you so much. You really had a great time. Thank you.
Thank you so much for having me. I enjoyed it.